Okay. Thanks to the ECD Global Alliance for inviting us to share our program with all of you. We want to talk about the importance of being close to the emotional impact experienced by people living with any disease. Rare diseases, such as histiocytosis ECD, profoundly affect psychological and emotional health. Patients and their families face isolation, fear, uncertainty, lack of information, and emotional overload. The healthcare system often lacks specialized and ongoing psychological support. We believe it's essential to complement medical treatment process with patient empowerment through emotional management and support. Challenges patients face, like impact of diagnosis, the emotional and psychological effects of receiving a diagnosis, including feelings of shock, fear, and uncertainty. The information management, navigating the influx of information from healthcare professionals and other sources, which may lead to a constant search for answers and understanding. This can lead to a constant search for answers, which may cause anxiety or confusion. Pain and grief. Managing physical pain and the emotional process of mourning and adjusting to a new reality, that day life. Relationship with oneself and the environment. It is essential for patients to develop a healthy relationship with their own identity, the new identity of illness. Learn to manage change and maintain social connections that provide support and understanding. Family and society. Intrafamiliar relationships can be affected, and managing emotions within the family is important. Additionally, societal perceptions and community support play a key role in coping. Emotional regulations, handling personal emotions, including feelings of lament or over-optimism from loved ones, is vital for maintaining emotional balance. Health and well-being. Learning to care for oneself through physical activity, staying active, and seeking professional support with a holistic approach that considers physical, psychosocial, and emotional needs. We are a team of 3 specialized psychologists. We attend childhood, adolescents, families, and adults. In a comprehensive approach, systemic therapy, narrative therapy, cognitive, constructivist, and grief therapy. 90% of our sessions are conducted online, reaching 7 countries now. International collaboration with the Histiocytosis Association and ACDGA simultaneous translation expansion. What we offer? We offer a free service, professional and personalized program, child and adolescent psychotherapy and psychomotricity, individual, family, and couples therapy, parenting guidance, monthly online support groups, one with adults with the diagnosis and the other one with the parents of a pediatric patients. Emotional and consciousness dynamics in the support process. In our work, we promote different practices that foster connection with emotions and the body, including dynamics of recognition, expression, ritualization, and mindfulness practice. We use writing exercise, visualization, verbal expression, sharing, and group elaboration to facilitate the process. It is essential to practice active listening, both towards others and oneself, always without judgment. Being open to feeling, accepting emotional variability, cultivating compassion, and respecting each other are fundamental pillars. Additionally, it's important to be available for social support, tolerate uncertainty, use humor, and explore personal narrative, understanding that each subjective experience is unique and valuable. We must be aware that what causes us discomfort or anxiety is not only the events themselves, but also how we connect our emotions to them. As Jonathan Garcia Allen points out, the way we manage our emotions in response to circumstances deeply influences of our well-being. Furthermore, we address specific topics through talks, 2 or 3 in a year more or less, talks such as welcoming emotions, the forgotten sibling, fear and uncertainty, turning fear into an advantage, or illness, obstacle, or change. All of these talks with the goal of caring for ourselves and supporting each other throughout the journey. Here you have a group of patient adults and a boy from Argentina that I am going with him 1.5 years. Feeling heard, understood, and supported. Building community and empowerment. Transforming pain into shared action. It's not so much about the disease itself, but about how they live with it. Emotional support matters. We don't just treat symptoms. We accompany stories, personal stories. We create a space to be vulnerable, connect and heal. In conclusion, addressing these challenges from a comprehensive and humanized perspective is crucial to improving patients' quality of life. Collaboration among professionals, families, and the community is essential to provide affective and empathetic support. Thank you for your attention.